Okay, class. Good job, good job. We're going to do chapter 12. Now we're going to do the lower extremity, legs. All right. So quick review. Number 1, trap. Number 2, deltoid. Number 3, pectoralis major. Number 5, biceps. Number 4, triceps. Number 6, rectus abdominis. 7, lats. 8, here's gluteus maximus, this gluteus medius. Number 9, you have rectus femoris, vastus lateralis, vastus medialis. And then number 10, you have biceps femoris, and then semitendinosus, semimembranosus, gastroc, and you have Achilles down here. Soleus is underneath the gastroc. The iliopsoas, which is right here, consists of the iliacus muscle and the psoas major, both of which flex the thigh. Okay. The medial compartment of the thigh contains the adductors, so you've got the adductor magnus, adductor brevis, adductor longus, and the gracilis. If you like to work out, if you like to, let's say, run on the outside versus running on the treadmill, one of the key things that you want to realize is that when you run on the treadmill, since the ground is moving for you, guess what? Your adductor magnus, adductor brevis, and adductor longus don't activate as much as if you were to go run on the outside. So those that train on the treadmill and then go run a marathon, usually they'll end up with a groin strain, or they'll come up with a hamstring strain because they're making up for their adductors. So bottom line is, if you can train outside, but there's a lot of people that work in or that live in Boston or New York where it's cold, or like right now we're stuck home. The only option is to work on the treadmill. So you do the best you can. Okay. Now, some common problems of low back and thigh. You get some referral patterns. Look at these referral patterns right here. So what internal organs, visceral pain would you want to rule out? So let's say somebody comes in as a patient has pain in their groin or pain in their back. You can't always assume that it's a muscle. It could be something else. It could be a muscle, but you could have obstruction of the urinary tract due to some calcium stones, and that could have some pain right in here. But usually muscular is like a dull, constant ache. If they have a ureteric colic, calcium stones or kidney stones, they're going to have the worst pain they've ever felt in their entire life. They're going to be screaming. And then you have an inguinal hernia. More men are susceptible to inguinal hernia because of the descent of the testes. The testes actually descended through this inguinal canal and then down to here. Women usually don't get inguinal hernias. All right. So you've got the glute max. Like I've mentioned, I think the glute max is often neglected. We're sitting on our butts right now, and it gets glute amnesia. You always want to think of creative ways to work the glute max. The gluteus medius, which is right in here, is responsible. If you have weakness here, you can get a lot of lateral knee pain, more so in ladies because your Q angle comes in because of the shape of the pelvis. So you want to work your gluteus medius more. Okay. Oh yeah, look at this. This guy works his glutes. Look at the fibers on here. That's amazing. I mean, this is unreal. So you can really work your glutes to the point where you can see all the striations here and here. Okay. Now, how do we get upright? People always, whatever you believe in, evolution or in God, but from a scientific standpoint, research suggests that human-like posture would have preceded the appearance of the human-like musculoskeletal morphology. Human gluteal morphology, which is glutes, therefore is a consequence and not a prerequisite of the upright bipedal posture. So basically what it's saying is that is a consequence. So it's not like you got glutes and then all of a sudden you were able to walk upright. It's you were walking upright and your glutes started to develop a little bit more to keep you upright. Okay, it kind of goes back to our giraffe analogy. You know, there were giraffes with small necks, medium necks, and long necks. And through survival of the fittest, only the giraffes with the long necks survived because they were able to eat and maintain good nutrition. All the ones with the short necks, unfortunately, were not able to reach up into the trees and therefore died off. Okay. Now, can a human outrun a cheetah in a marathon? Now, the key is a marathon. If cheetah eats you in the first 100 meters, then I'm sorry, you're dead. But unlike a cheetah, we sweat. So we can actually, and cheetahs unfortunately don't sweat. So they have to stop, they pant, and when they stop, that's when you can outrun them. Okay, so those are things that you want to understand. And that, but again, if that cheetah comes at you in the first 100 meters, 100 yards, sorry, hasta la vista. Now, if you have a glute medius weakness, okay, so if you have weakness in your glute medius, you can get ACL injuries or tears, ankle sprains, IT band syndrome, and patellofemoral issues. So glute medius weakness is very common, and I'm going to show you some exercises to really work the glute medius, and those are sideline clams, sideline hip abduction, the side planks, a single leg deadlift, and single leg balance. They've shown in EMG studies to be the top 5 exercises for glute med. So if you're a woman, if you're and you play sports, or if you have knee pain, start by doing 5 exercises. Again, I can't, everyone's a little bit individual, but they found that these exercises are very good. Okay, there's a lot of research that shows that if they start doing this, a lot of their anterior knee pain will go away. Okay. Here's some anterior muscles of the thigh. You've got the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius here. Quadriceps femoris. So those make up the quad. So these 4 muscles make up your quadriceps. Quad meaning 4. That's the vastus lateralis, vastus medialis, and the vastus intermedius. And they all are innervated by the femoral nerve and insert into the tibial tuberosity. Oh, you can get quad ruptures. Look at that. Where that ruptures right there. How do you do that? You miss a step, football injuries. Bill Clinton actually tore his quadricep rupture. Boogie Cousins, DeMarcus Cousins from the Los Angeles Lakers, he did that as well. So very common. Well, I showed you this example in last class. Again, I miss having class because I can't give you full live examples. But here's that butt wink, right? So if you want to stay straight right here, if you go too far down, then your butt tends to wink right at the end, and that will put more stress on your low back. So you want to stop right before you get to that butt wink. And sometimes it's just structure limits function, meaning maybe it's just the way that you're born and the way that your hips are that it just limits how far you can go down. So you don't want to go down where you see that butt wink. So videotape yourself since you're at home. Maybe do a squat and see when you start to do that butt wink and stop right before you do that. Okay. Here's the TFL. This is what you like to foam roll. Unfortunately, this is fascia, and the research shows that it takes about 900 Newton-pounds of force to even stretch this 1%. So when you foam roll, unfortunately, it does give you relief, but I want you to understand it's temporary relief. You will never stretch this to the point where you'll never have to foam roll again. If you remember from the origin insertion, actually the glutes attach to the IT band right here. So if you actually strengthen the glutes, a lot of times it will take pressure off this IT band fascia. So it goes back to the glutes. Strengthen the glutes, less pressure here. You won't have to foam roll as much. Okay. The posterior compartment, you've got the biceps femoris, semitendinosus, semimembranosus. Those are your hamstrings. Try to be creative and exercise those while you're locked up in your house. Oh, look at these hamstring injuries. Ouch. Some hamstring tears will bruise black and blue from the hip all the way down to the foot. Ouch. Yeah, that's very common. Okay. Football is one of those. Running, soccer is another one. Oh, now you can work the hamstrings. Look at this. You can get hamstrings that look like that. Now be careful with, so I like the stiff-legged deadlifts. Deadlifts are really good. Standing leg curls. When you do these lying leg curls, you'll see a lot of people that their back starts to arch and their butt goes up in the air. So you're not ready for that yet. Maybe do some seated leg curls, standing leg curls, and work on the getting some strength before you go here. So if you see yourself doing this and your back arches or your back hurts after doing this, well, you're weak here and you're starting to use your back, so you might want to lay off this. Or if you're starting to do stiff leg and your back hurts, that means you're weak here and you'll start to substitute with your back. Muscles of the leg, you've got your anterior tib, you've got your gastrocs, extensor hallucis longus. Okay. Here's the extensor digitorum longus, extensor hallucis longus. The posterior compartment is the gastroc and the soleus. Gastroc is what helps. It's got help you come up on your toes. Okay, and the soleus is more postural muscle. Now, if you see a patient comes in with one gastroc or soleus larger than the left, let's say their right gastroc is huge compared to their left, well, what happens is your body starts to compensate because their glutes are weak. So you'll start using your gastroc, and then they'll also have low back pain. So again, your body does a good job of compensating. So here's the deeper ones. Tibialis, you have a tibialis posterior, and a lot of these you just want to know which ones are on your OIN, but there are a lot more muscles. Popliteus, plantaris, I don't think those are on your list, but I did want to show you this. That's posterior, you don't really need to know orange insertion. Flexor digitorum longus, flexor hallucis longus, and then here's muscles of the foot. Again, when I'm treating patients with feet, I'm not a big fan of feet. But ladies, when you're wearing high heels, you got to be careful. Look at what your foot looks like on an x-ray in barefoot in high heels. Look how that is. It's all scrunched up in there, so you'll start to see bunions. You might get knee pain. You might get low back pain. You might get plantar fasciitis, metatarsalgia, Haglund's deformity, which is this bump. They call it the pump bump back here. You get this callus back here. But this is not very normal. So some of you do like wearing high heels. Take your pictures and then get out of them as fast as you can. All right. So it's all connected. Look at these high heels. You can get plantar fascia, calf muscles become, the Achilles tendon gets real tight. Hamstring stress cause tightness. Pelvis, tense hamstrings pull the pelvis, causing glute max or sciatica pain, low back pain. And then look at this. Your foot's eventually going to look like this. It's nasty. Oh, nice little toe ring, but look at this big toe. This is disgusting. But that's 4, 5, 6 inches right there. So try to go 1 to 2 inches if you can. Like I always tell you, you go to a wedding, you wear your 4, 5, 6 inches. By the time the wedding's over, you usually have those off because your feet are killing you. What shoes are the best? Again, there's some good shoes out there. There's some bad shoes out there. People like Nikes, but for walking, Nikes are probably not the best. Nikes are good for basketball, so high tops, they make a really good shoe. But for walking, Brooks, New Balance, Asics, and Saucony are good. Unfortunately, people call these old man shoes or old women shoes because they're not the greatest. I don't understand why they can't make a good-looking walking shoe. I mean, they got weird colors, weird designs. This one, this black and white one, this one's not bad. I like this New Balance. I think the New Balance 1080s and the 860s are probably one of the better ones. So if you're going to be on your feet a lot, look into New Balance, Asics, and Saucony. All right, good job, guys.